Hello, my name is Dr. Funda Goldman. I'm a licensed naturopathic physician with a private practice in Stratford, Connecticut in the United States. And today I'd like to talk to you about a specific technique in hydrotherapy called a contrast shower. Before we get too far though, let me just note that, the information presented here is for educational purposes only and should not be considered medical advice. For any problems that are persistent or worsening, please consult with a qualified medical professional for individual medical advice. So what is hydrotherapy? From a naturopathic point of view, hydrotherapy is a therapeutic use of water to treat disease, and it is also traditionally known as water cure. There are some other terms that sound like hydrotherapy and are close to hydrotherapy, but they're not hydrotherapy in the way that we typically mean it. There is, for example, balneotherapy, which is curing disease by bathing. That's one specific sort of technique within hydrotherapy. There's also hydropathy, which is the use of hot and cold to effect cure. And water can be a vehicle in this type of therapy, but it is not necessarily the only way of delivering the hot and cold treatment. Thermotherapeutics is a modern term for hydropathy. There's also thalassotherapy, which is curing disease with seawater specifically. And then there's water therapy, which is a kind of physical exercise or therapy in water. So just to give you a little bit of clarification about what I mean by hydrotherapy as we go through this. So the technique that I'm talking about today may seem deceptively simple, but it's actually quite profound. So the method is to take a warm, regular shower. Typically this takes a few minutes, 5 or so minutes for people. And then at the end of that warm shower, you're going to turn the water to cooler water and apply that to the body for 30 to 60 seconds. So again, this sounds really simple, but it's immensely helpful in many ways. And actually, just to give you some examples of that, when I used to be a professor of hydrotherapy at some point in my career and was teaching medical students how to use hydrotherapy, and I gave them a semester assignment. One of their assignments was to choose one of the therapies that we talked about in class and apply it to themselves, and then they had to kind of write up their experience about it. And because they were a bunch of busy medical students and they saw that this was only like 30 or 60 seconds extra of their day to do this method, they thought, okay, let's just, do this one because it's fast and easy, or so they thought. And they were supposed to do it every day for 7 days. But the thing is that when I got their reports back, you could see within their writing that they were completely shocked by how much this 30 to 60 seconds of running cool water on themselves after a warm shower really helped them. And they would write about things like back pain that had cleared up, fatigue. They were very stressed out and exhausted running around their medical classes, and fatigue went away, insomnia got better, skin cleared up. Again, they were shocked, but that was actually part of the reason why I assigned that to them, potentially. I mean, they had a choice of different therapies, but part of the reason why I had this on the list was because I wanted them to develop a bit of empathy and understanding truly of what this therapy entailed and the power of it, because, if they're going to talk to you about it with patients, and the patients might just sort of blow them off with, oh, it's only 30 to 60 seconds of cold water. What's the big deal? Well, until you do it every day for a week, you may not really understand the power of it. So simple technique, but profound in action. So why does this work? I mean, why would we do this? Just the 30 or 60 seconds of cold water rinse at the end of a warm shower. Well, what happens first is that the warm water will vasodilate blood vessels, and so what happens is it brings blood to the surface, and that's why you look sort of pink, that sort of thing after a warm shower. So it brings the blood to the surface of the body. Then when you apply the cold application, it constricts the blood vessels, so the blood goes back to the center of the body, back to the core. And then once you finish the quote-unquote treatment, your body, even after the treatment, will take some time to reestablish equilibrium and equalize the blood flow in different parts of the body. So the end result of all this is that there's this pumping action within the circulation. And with that pumping action, it increases blood flow, including higher levels of good nutrition oxygen to tissues, and it also helps to eliminate toxins and inflammatory molecules. So it's a really great tonifying mechanism. So what sort of things are helped? Well, I mentioned a few that my medical students, saw within themselves, even within a week of using this sort of therapy. But typically, it can be helpful with immune stimulation, chronic inflammation, infections. So things that are stuck, you can kind of think about it that way, that need a little bit of stimulation, a little bit of good blood flow. Things like arthritis and other sorts of pain can be helped by this. Congestion can be helped with this, swelling and poor circulation. Because it is a stimulating therapy, even prolapsed organs, because again, once the organ kind of loses its tone, part of that translates into losing tone of the blood vessels around it, and so those organs, once they're prolapsed, don't tend to get good blood flow anymore. It can also help with detoxification, and because it is a stimulating therapy, it can be helpful for things like depression and fatigue. So there are definitely cases in which this is not an appropriate therapy, and some of those include cold allergies. So if you actually have an allergy to cold things, cold water, that's not a good idea. If you have a weak heart and or lungs, things such as tachycardia, asthma, high blood pressure, deep vein thrombosis or stroke, any of those sorts of things, because we're stimulating the circulatory system, if the circulatory system is really quite compromised, this may overpower the circulation to bounce back in an appropriate way, and so that may be too much. Any sort of hemorrhage, because again, we're increasing circulation, any sort of hemorrhage or bleeding can be exacerbated by this type of therapy. Skin conditions that are worse from water, things such as open wounds, lesions, or recent surgery, because those wounds can swell up because of the increase in the circulation. And like if you have recent surgical sutures, for example, it might split the skin. So you want to clear that, with your surgeon if you've had recent surgery. Also, because this is a stimulating therapy, you don't necessarily want to do it in the evening, especially if you have insomnia. Because it's stimulating, you might want to do this in the morning and or afternoon. Pregnancy, that's usually, it's just, again, maybe perhaps too stimulating for somebody who's pregnant. There may be some other options that are less stimulating for pregnant women. Anybody who has physical, mental, emotional instability, again, because it's stimulating, it can sort of temporarily, stimulate them and throw them a little bit off balance. So that should be avoided. And also, anybody who has the inability to detect temperature by touch, they may use water that's too hot or too cold and then hurt themselves that way. So these are just some of the considerations. Obviously, anybody who's just really super weak, this again may be too stimulating of a therapy for them and inappropriate. So adjustments that can be made is that you can begin this treatment with less contrast, meaning less difference between the warm part of the therapy and the cool part of the therapy, and less time. So maybe the first day you would do warm shower and then just sort of neutral water for 10 seconds, and then you would slowly increase that day by day. So the next day you might do slightly cooler water for 20 seconds, and then, increase that over the course of, say, a week or so, a week or two, and by the end of the week, you would have a fairly warm shower and a fairly cool water. But I wouldn't do extreme. You still want to watch extremes. No extreme heat and no extreme cool. Again, just the contrast is plenty to stimulate the body to do what it needs to do. And again, it only takes about a week to adjust. I do have patients that, you tell them about, running cool water over their body, and they tend to be cold anyway, and then they just sort of look at you like, what, are you serious? So the thing is that the body does adjust, and actually this is actually sometimes a very helpful therapy for people who are always cold, because people who are always cold usually have some sort of circulation, compromised circulation. And so I remember the first year that I was working with this myself, after I'd learned it, I tended to get really cold in the winters, and when I was using this therapy, even in the winter, I, because my circulation was better, I actually felt warmer. So there's that to consider. Not everybody has a shower. You can use a tub, in which case you would do the warm bath for about 5 to 10 minutes, and then you would do a cool rinse. You could also do something like a warm activity instead of a warm shower. So maybe you're outside gardening or exercising or doing warm yoga or something like this. And then you would do a cool rinse afterwards, and that has similar uh, indications or actions as this contrast shower that I've been talking about. The other thing is that you can do local applications. So maybe you don't have a whole shower. Maybe you're just interested in like your hands, for example, or your feet that have a problem. I've had a couple patients, like recently I had a patient who had edema, so swelling around the ankles, and had some neuropathy as well. And his history was that he was a teacher. So he was somebody who basically stood up almost all day for many days for at least 30 years. And because of that, just standing up all day for so long, usually teachers and people who have that sort of situation when they work over time, because it's so hard for the body to get the blood returned back to the heart, because blood returned back to the heart is passive, blood flow out from the heart is active, blood flow back to the heart is passive, then what happens is that veins, they start to dilate and they start to get sort of worn out and lose their tone. It's sort of tell patients it's sort of like old socks, where they lose their elasticity and they kind of keep falling down, that sort of thing. They just don't have that spring back in them to bring them back. So yeah, so he had that situation, and he didn't have, I think, a whole tub, but we did this with buckets. So he did the warm bucket first for 5 to 10 minutes, and then he did the cool. And the next time he came in, the edema, all that swelling was gone around his ankles. So, we were trying to get that pressure off his ankles and the nerves in that tissue to help the neuropathy. And I've had other people too, like one woman I remember, she was 80 or so, and she came in a wheelchair. She actually had gout. So that's like little crystals of uric acid build up in spots, and then especially if it's under your feet, when you try to walk, it feels like you're walking on glass because you're walking on those crystals. And because she had this, and it came as a result of some hypertension medication that she took that sort of dried her out too much, too fast. Um, so the gout crystals, the uric acid crystals, consolidated and created problems for her. And she had a heart condition, so we couldn't do a whole body therapy on her. It was going to be too much because, again, weak lung and heart is contraindication for a contrast shower. So we also did the bucket therapy with her feet. Um, and actually, it really reduced the pain very quickly. And the next time she came in for appointment, she actually was out of her wheelchair. She could walk on her feet. So, again, it doesn't sound like a lot, but this kind of therapy can be very helpful. So today's talk, a little bit short and sweet, but I did want to dedicate it to Dr. Guru Sandesh Singh Khalsa. He's a former dean, or was a former dean at the University of Bridgeport College of Naturopathic Medicine. He was dean of the school while I was there, and I worked closely with him to support the school. Unfortunately, he passed away last week, and in addition to working with him while I was a student, I was president of the student government of the medical college while I was there. And then after I graduated, I was hired to teach. And one of the things I was hired to teach was hydrotherapy. And because of that, I realized what a deep passion I had for this subject. And actually, the photos and things that you've seen in this talk are pictures. Basically, whenever I travel around the world, I look for places that are remnants of, I think, former days that held this lost art in high regard. And this particular picture here is considered to be the heart of Acadia National Park in Maine, United States. And this is a kind of a cover, but there's a natural spring under that cover. And back in the day, it was really great drinking water, and so somebody had the idea of developing it into some sort of bottled water type place. And somebody had the notion that, they really wanted to protect the land and the purity of the land. So they actually bought a swatch of land, and within about 20 years or so, that became the beginning of Acadia National Park, which many people visit yearly. And you think about it, and it's just so amazing that somebody like this man who sort of sprouted the idea of Acadia, and I would say the same about Dr. Khalsa, is that, they both seeded protection and love of nature and love of natural medicine in their own ways, and had profound, lasting effects for many, many years. And I am deeply grateful. So thank you for your time. There are additional videos here. I'll leave some links here and in the description box below in case you're interested in more videos on hydrotherapy. Take care. Until next time.